Okay, looks like we can get started here. Just want to start out by thanking you so much for joining us today. I'm sure we'll have a few more people trickle in, but just want to go ahead and respect everybody's time and get started. So today's webinar is our quarterly webinar for medical providers and hearing professionals. If you haven't joined us before, welcome. We're glad to have you with us. If you have, then we hope to have some helpful updates for you and be able to answer some additional questions. We do use the Q&A feature in WebEx for these webinars. So if you do have any questions along the way, please feel free to pop them into the Q&A box and we will answer them. If not as we go, then at least at the end. These also help inform our FAQs and resources for future events and help make all of the information more accessible for everybody. So thank you in advance for sharing any questions you have. So again, this is the Hearing Aid Coverage for Children program. We're at the state and we love acronyms, so we'll be calling it HACCP quite often today. Just wanted to take a moment to share that this presentation is being recorded and is going to be available online at the DHCS webpage for HACCP Events Archive. So the link is right here, and then we've also shared in the chat box, and I'll share it again momentarily for anybody else joining us, that real-time captions are available for today's webinar, and those are available online at the URL listed. I'm just going to share it one more time right now, and then Stephen, maybe you can help me add that in to the chat box in a little bit as well, please. Okay, so just to kind of briefly share some overview, and then we've added some notes in case you want to come back later and dig a little bit deeper. HACCP was initially authorized in the Budget Act of 2020. So we're still a rather young program in the scheme of things here, but that gives us some really nice agility, and we've got some much more experienced programs that we've been able to build off of and grow alongside. So we're very excited that we can be based on the Medi-Cal fee-for-service coverage systems and platform that already serve so many Californians. We've also gotten quite a lot of expertise that has been shared with us from the California Children's Services specialists in audiology and hearing related coverage, and many of the audiology stakeholders that help the department out with subject matter expertise in this area, including, I believe, some of you. HACCP covers a variety of hearing aid related benefits, everything from the main hearing aid itself, which might also include an assistive listening device or bone conduction hearing device. So those are ALDs and BCHDs respectively, where medically necessary, to the accessories and supplies that are medically necessary for that hearing aid to operate appropriately for a particular child, and the related audiology and physician services. So there's a more comprehensive list available on the Department of Healthcare Services website for the HACCP provider manual. That's linked here. That list is always growing. We're actually working on some additional publications for this provider manual right now. So those will be out likely within the next month or so. We're excited to be able to provide the additional expanded resources for you. My apologies. Coverage determinations for this program, like for children the same age enrolled in Medi-Cal, are based on medical necessity. So they're not capped at a certain annual amount. We do have an eligibility and enrollment process that happens before a child can start receiving covered benefits. And so anywhere from birth to age of 21st birthday is age eligible for the program. Children must also be a resident of California. If you move out of state, you're no longer eligible. But in some cases, we might be able to help you find a similar program in your new state. Additionally, this program is designed for children with a household income up to 600% of the federal poverty level, or FPL, who don't have health coverage for hearing aids. So that's going to be children who are not eligible for Medi-Cal, who are not enrolled in California Children's Services or CCS for a hearing related condition, and children who either are uninsured or if enrolled in a health plan, that plan either carves out hearing aids or limits annual benefits for hearing aids to $1,500 or less. Enrollment requires a referral from a medical provider or hearing professional. So that could be the audiometrist conducting their school hearing exam, for example, or it can be their newborn hearing screening program. My apologies. As long as that includes that there is some level of hearing related education or certification, it's very flexible, or any sort of medical training or certification. So a school nurse could sign off on the referral form. You can also provide a free form referral letter if that's more convenient, or a valid hearing aid prescription also works. And we have a link here to the provider referral for patient enrollment form, if that's more convenient. So we talked about the 600% FPL limit. The lower end of income eligibility depends on which county you're a member or applicant is in and how old they are. So if they qualify for Medi-Cal for kids, that's going to start at 266% FPL, or if they're in a CCHIP county, then that would not start until 322%. So either from 266% to 600% or 322% to 600%. It's going to be that sweet spot for children under 18. And then similarly for children over 18, or I guess young adults, we'd be looking at the applicable Medi-Cal eligibility income threshold up to 600% FPL. So if someone applies and is actually eligible for Medi-Cal, we want to assist them in getting that full scope of benefits, right? HACCP essentially takes the hearing aid portion of Medi-Cal benefits and makes those available to an additional population. So we'll go through here. The enrollment process itself, for families who meet these criteria, it's pretty straightforward. There's an online form located within a secure portal at haccp.dhcs.ca.gov. It's the same link that's on your screen. Families can upload the required documentation directly to include with their application. So you're gonna fill out a little form and then attach their documentation of household income. It's often like a W-2 or similar documentation, or tax form from last year, their existing health coverage, and then hearing aid prescription or provider referral, depending on which applies. So if the child just doesn't have existing health coverage at all, there's similarly a box they can check to just confirm that, so we know they're not missing anything. Eligibility is generally determined and actually sent out in the mail, getting to them within 10 days from our receipt of a complete application. So complete means there weren't any documentation missing. They actually filled out the form. Sometimes folks will submit applications in like a little bit more piecemeal. That's fine. You know, we'll end up letting them know what the reference number is so they can match up any additional documents as they go, and kind of save it with them for up to 60 days. And any of that missing information can also be uploaded securely through the web chat that's on the HACCP webpage. Once they're enrolled, they're going to be looking for a participating provider unless they're already established with a pediatric hearing aid provider who is enrolled as a Medi-Cal provider. So participating in HACCP from the services side is two pieces potentially. So the main aspect is that you need to be enrolled as a Medi-Cal provider so that you can bill using the fee-for-service Medi-Cal processes, because we appreciate the work that you do and we would like to be able to pay you for it. So that works out better for everybody. The second part, and the part that's more specific to HACCP, is that we have a program-specific provider locator where families can click through to the link that's on the screen, and they are taken to essentially a searchable map that lets them put in where they're located and brings up any of the providers who have opted into the HACCP provider locator. If you are enrolled in Medi-Cal and interested in helping HACCP members, but you have not already opted into the provider locator, we would very much like to have you listed there, and to be able to help connect you with HACCP members who are looking for a provider that does what you do. There are lots of customization options already, and this is another area that we're constantly looking to make even better and more helpful for you and for the families that are searching for providers. So again, it makes things much, much easier for families who are looking for a provider if they can locate you in their area easily with the provider locator. Medi-Cal and HACCP both use a treatment authorization request, or TAR, process to support the appropriate use of covered benefits. Some benefits are always going to require a TAR for medical necessity, while others only require a TAR after a certain quantity. Hearing aids always require an approved TAR. So that's going to include the other kind of specialty devices that we mentioned being within that category as well, right? ALDs and BCHDs are always going to require a TAR as well. Some other procedure codes or billing codes might only require a TAR if you need more than a certain number of them. So ear molds are a really common one that if you don't need more than 2 at a time on the same date of service, and you don't need more than 4 within the same year, then you don't actually need a TAR for it. But if you start using more than those thresholds, that's when there's a TAR requirement, just to make sure, basically there wasn't some accident in the billing system that we're overpaying for something different than what you mean to be billing for. So it's just like a double check to make sure that this kind of aligns with what treatment has been approved. DHCS anticipates responding to most TARs within 30 days of receipt. I don't mind being a third-party cheerleader for the team that reviews these TARs. They are fantastic and professional and do a very good job of getting the TARs approved much faster than this in most cases. It's similar to enrollment applications. The big thing is, did we get all of the information that we needed attached to the TAR? So we're going to go through what that takes in a minute. And I think probably within about the next 15 minutes, you'll be experts on what to include in your TAR. And if you do have any questions or come across a unique case that you're not sure which things to attach, you can always let us know, and we would be happy to work with you and make sure that you're comfortable with what to attach and include. The team is really good about reaching out if they have any questions, or if you see a TAR status that says deferred, it just means it went on hold. It's not anything negative. It just means we're reaching out to you for additional information. Because they do everything they can to avoid denying any of these TARs. We really, really want to make sure that all of the kids who are asking for hearing aids are able to get the care that they need. When a TAR is required, it can be submitted for review either before or after rendering the service, but it has to be approved before you can submit the claim for reimbursement. So the claim does need to include the approved TAR number. Or you might see it listed as TAR control number or even TCN in some places. That's what they're talking about. It's just what was the number assigned to the TAR that got approved for the same service. You're going to want to make sure that you've requested consistent dates of service and the billing code is the same, things like that. Just all line up with what was approved. Additionally, specific documentation needs to be included with any TARs for new hearing aids, replacement hearing aids where one was lost, stolen, or damaged, replacement hearing aids if the old hearing aid no longer meets the need of the member, but maybe it's not um, been the full anticipated useful lifetime of the device yet. Sometimes needs change faster than devices need to be retired, but we want to make sure that each HACCP member is having their specific amplification needs met. Additionally, there's certain documentation that would need to be required with TARS for hearing aid repairs. The scope of a repair can vary quite a lot. We want to make sure that we're approving things at the level that you need. HACCP does use the same standard of medical necessity that applies to Medi-Cal children the same age. So for children and young adults under 21, that's going to be just looking at whether the requested benefit will correct or ameliorate a defect or physical and mental illness or condition discovered through screening. So we say ameliorate has been used in different ways over time, but what we're looking at is whether it's going to make it better. It doesn't have to be a complete elimination of a symptom. It doesn't need to be a complete cure of whatever the diagnosis was. It just needs to help. Because of this and how flexible that standard is, there's not a particular hearing loss threshold that's required for a hearing aid TAR to be approved, as long as there is some measurable improvement of the patient's hearing. So you need to include articulated documentation of what that improvement is and your clinical reasoning. You're the experts on helping your patients. We want to just make sure that there's coverage for what is medically necessary for each one. So we rely very heavily on what you tell us. And because of that, it's almost more important to just make sure everything is included sometimes than that anything meets a specific threshold, because usually if you're submitting paperwork that something improves a patient's hearing experience, you're doing that for a reason, right? So it's just a matter of kind of spelling that out to us a little bit. Traditional standards work, right? Booth testing and pure tone average, but we recognize that sometimes alternate testing is also clinically appropriate. So that could be otoacoustic emissions or electroacoustic testing. If you have some degree of test results measuring comparable hearing or speech perception with and without the hearing aid, that would be one way. We definitely appreciate any sort of concrete documentation you can include, and it certainly alleviates the describing effort that you might have to include. If you're relying on non-testing measures of improved hearing or speech perception, that's where we really need you to spell out for us more like what your observations and clinical reasoning are as to how this helps your patient, if it can't be captured from a test result approach. So generally that includes describing what the benefits are, something more specific than just the child appears to benefit. Let us know why you believe the child benefits from the device based on what you've observed. Similarly, we can't just approve the use of taxpayer dollars for a trial and error if it's very uncertain. But if you have clinical reasoning as to why you believe a recommended approach will be successful in helping a child, that's a lot more likely to be kind of immediately successful. If something is truly uncertain, even despite that, we'll probably be able to recommend specific additional testing and evaluation that could provide the necessary documentation to kind of fill that gap. But the bottom line is that the TAR review team really is working with providers to help the HACCP members. So we really want to make sure that we're helping you get approvals for TARs that are to help patients enrolled in HACCP. So it's definitely a collaborative process. And if you do have any questions or would like to walk through any of this for the first time, we're happy to set up kind of a sort of orientation within a secure screen share scenario where our systems experts and TAR reviewers can walk through with you as well and just kind of show you, if you've got an example, we can help you out. Let's submit this TAR together. Okay, now you're going to fill in this blank. If you have a question here along the way, we're right there with answers, just making it easy and more comfortable for the first time. If you've worked with Medi-Cal for a while, this is probably very familiar and already comfortable, but if you come across new questions, we're still here to help, and definitely appreciate any questions you bring our way. TARs can be submitted online with an e-TAR on the Medi-Cal provider website. And I actually see this question, so this is perfect timing. They can either be submitted online as an e-TAR through the Medi-Cal provider website at medical.ca.gov. From the provider portal drop-down menu, you would select log in to transaction services. If you have any questions when submitting an e-TAR, you can always reach out to the Medi-Cal Telephone Service Center, or TSC, at 800-541-5555. The most important thing you can do when you're submitting an e-TAR for HACCP is to select from the special handling drop-down box in the form, Hearing Aid Coverage for Children Program HACCP as the special handling code. This is on the patient information page. This special handling helps to make sure that the TAR goes to the specific team that's familiar with this and can help you the fastest and most comprehensively to get this approved. If it's routed incorrectly by not having the special handling code, it can just cause delays and may need to be resubmitted, or it's easier for everybody if we use the special handling code. And we would like the opportunity to make it a faster process for you and your patient as well. You can also submit a paper TAR. We really, really recommend using the e-TAR process, however, because then you can attach your supporting documentation quickly, most efficiently. You don't have to worry about stamps or making sure that we received an envelope in the mail. If there is missing information, you can still attach that directly within the provider portal as well, which is much more convenient than sending a separate envelope and hoping you used similar handwriting to note the member ID and name and everything else, and there were no misspellings anywhere so that we can match it up. It's just a lot easier to just click back into a TAR that was already submitted online and just attach an extra document. And there's no lag from the mail. That said, if you would like to mail the paper TAR or as a backup, if you're ever having internet issues, I suppose, you can mail in a paper TAR using the 50-1 form and your supporting documentation. Really recommend, if you're sending it this way, you double check you've got all of the supporting documentation the first time, so it is all together. Paper TARs can be mailed to the TAR Processing Center at PO Box 13029 in Sacramento. The zip code and everything is on your screen. For paper 50-1 TARs, providers must clearly write HACCP in the medical justification section of the form. This is in place of the special handling space that we have on the e-TAR. Since we can have a drop down on the paper form, this is the closest we could get. So I think that's the one thing to really remember, since there's not something on the form custom to HACCP to prompt you, is just make sure that we write this in. Again, if you need any TAR assistance, you would contact the same phone number, the TSC, or the Medi-Cal Systems folks to be able to help you with that process. If you have questions about what HACCP requires for TAR documentation, you can also reach out to HACCP directly, and we'll have that contact information for you at the end of the slides. In order to have your TAR processed in a timely manner, we've mentioned this a few times, but just again, it's really, really important to include any of the required supporting documentation. For new hearing aids, your child's audiologist needs to include the following documents when they submit a TAR. So there's 4 big documents. Sometimes multiple from the same provider might be included in the same document, which I'll give you an example in a minute here. That's fine, as long as we have all 4 of the components, even if some of them share an attachment file. So there are 2 that are from an otolaryngologist, right? We've got the hearing aid prescription, which we understand is not going to be on a script pad like if you're going to fill something at Walgreens. So what we usually see a lot of the time with hearing aids specifically is that the prescription authorization may be included as a conclusion within the next document, which is the signed medical history and physical examination by an otolaryngologist. So that's the full head and neck exam, the physical hands-on exam that rules out perhaps a diagnosis that might have a more appropriate treatment than amplification. You know, I'm sure the folks in this group are going to know better than most that hearing aids are not one size fits all. So we want to make sure that each child is getting the best medically necessary care that they need and not just jumping straight to hearing aids. So that medical history and physical examination from an otolaryngologist does need to be included. The hearing aid prescription can be attached from an otolaryngologist as a separate file, or it can be included within the same file as the history and examination, either way. And then from an audiologist, generally we would need the signed audiologic report and hearing aid evaluation with a specification of the ear to be fitted. Again, sometimes this is a separate attachment, sometimes it's part of the same document. Either way, we just need to make sure we have both files. We also need these to be current. So preferably within the last 6 months. Some of these up to 12 months is fine. But really wanting to make sure that we're not using something from a couple of years ago, since children grow and change so quickly. And we want to make sure that our approval and the benefits that we're making sure we cover for these kids are appropriate to what they need currently. So documentation requirements for new hearing aids, repairs, replacements can all be found in the HACCP section of the Medi-Cal Provider Manual, or commonly referred to it just as the HACCP Provider Manual. It's linked here. That said, there are also Medi-Cal Provider Manuals that go into additional detail on some of the TAR requirements for the less common circumstances. Anytime the HACCP doesn't have its own policy, it's a safe bet that we're relying on the Medi-Cal fee-for-service policy for the same age group. So if you ever have a question, definitely let us know, and we'll help confirm or point you in the right direction, or say, oh, actually there is an HACCP policy right, on this webpage. Because those questions and feedback, again, help us make sure that we're putting things in all the most helpful places for you to find where you're kind of instinctually looking as well. We included some FAQs for the authorization process and reimbursement. Enrollment in HACCP and receipt of an HACCP ID card are separate from TAR approval. So we often get asked, once the child has an HACCP ID card, does that mean they're good to go? No, for two main reasons. Some services require a TAR, some don't. But if a service requires a TAR, the TAR approval is required separately from enrollment. The HACCP ID card just says, oh, this child was at some point enrolled in HACCP. So the other reason there is, we're actually going to kind of jump down a little bit and merge with the fourth question down, which is how should providers confirm benefits are active or that hearing aids have not been provided by another vendor, making this patient ineligible for new hearing aids until their current hearing aids have reached their useful lifetime. This brings in HACCP enrollment is generally valid for up to 12 months. And then the family completes an annual eligibility review to confirm that they're still eligible and extends their child's coverage period. Because of that, Medi-Cal providers participating in HACCP are going to use the same process, the automated eligibility verification system, or AVES, that you use for Medi-Cal patients. You're going to check their ID number and issue date on their program-specific ID card that they will have gotten with their welcome letter for each date of service to make sure, yes, this individual actually has enrollment status on the date. Duplicate hearing aid requests are then going to be eliminated by the TAR process itself. And again, if there's been some sort of change in the member's needs since their hearing aids were dispensed, maybe it's been 2 years ago instead of 3 or 4, or whatever the useful lifetime is on a particular device, but the existing device no longer meets their needs, we have processes for that, so it's not weeded out as a duplicate, right? And that's where you're going to attach the documentation, just explaining what the change is and why the existing device doesn't meet their needs anymore. So again, there are more details on all of that for the documentation within the provider manuals. But it's really just relying on the same systems you're already used to for Medi-Cal. The other question, sorry, hopping back up to number 2 up here, is whether the authorization is tied to a particular center for all services, or if a patient and family can seek different services at different centers. And if so, can families change providers? So this is a more common question for providers who are used to working with CCS, because then you've got the service code group authorization or the service authorization request that includes so many related procedure codes. And it would all be provided through a designated center. That's not the case with Medi-Cal and HACCP. We're a little bit more flexible. So if you want to get your hearing aids dispensed at one place and your otolaryngologist exam done elsewhere, okay, that's fairly common. That's fine. But you've got to make sure that the audiologist dispensing the hearing aids is the one who submitted the TAR that got approved for the hearing aids, or else they're not going to be able to get the claim paid because the provider on the TAR, the claim also needs to match. So families can change providers, but if you change providers, or if they change providers after already starting the TAR process for a particular benefit, they can either finish out that benefit with the existing provider, or they can let you know, if you're the new provider, hey, I already started this process, but we moved, or what have you. So then the new provider just needs to let us know when you're submitting a TAR with your provider ID, hey, this does duplicate a prior TAR, but it's an intentional replacement. So here's the documentation, making sure everything's current. Or here's the existing TAR number that was already approved that we're replacing. Just help us kind of connect the dots so we don't delete the new one as a duplicate, but help make sure that you've got the right approval in place for you to be able to get paid when you submit your claim. What is the time frame for TAR review? Again, we anticipate responding to most TARs within 30 days of receipt. Hypothetically, it can go over that if we're waiting for some documentation, but when we defer a TAR, there's also a 30-day time limit that goes into play to make sure that we get the documentation back in a timely manner. Excuse me. And then authorizations are also issued per procedure code. Rather than as a group. So we don't have a pre-designated service code group like CCS would have the corresponding SCG04. We have each individual procedure code, but we have an ETAR system that allows you to add multiple line items at the same time or within the same TAR. So if you're submitting an ETAR for your patient's hearing aids, and you know at the same time that because of their age or growth rate or whatnot, you anticipate that they'll need 8 ear molds within the next 12 months instead of 4 or less. Okay, so you add 8 ear molds as another line item, and any of the additional testing or anything else that might need a TAR, any particular supplies or accessories that may include a TAR that you anticipate them needing within the next 12 months. Because you can use a date of service range of up to 12 months. So make sure you use the broad date range, but then you basically build your own service code group for what you anticipate is going to be necessary for this patient. And for the most part, the documentation you're already attaching related to the hearing aid TAR is going to include the documentation we need for those other related items. So you've just saved yourself several separate TARs, and you just built your own custom kind of group authorization. But we don't automatically convert it over to a preset group of procedure codes. It'll be per procedure code that you submitted, but you can submit several at a time. For reimbursement, HACCP uses the same Medi-Cal fee-for-service rates and reimbursement policies as Medi-Cal fee-for-service. So all of those Medi-Cal rates can be found online. We've included the link here for the rates kind of searchable database or spreadsheet. If you see one that says like $0.00 or $0.01, that's just shorthand. And there's a key to explain these, but just kind of to circumvent one of the more common questions we get on these, that just means that it's reimbursed by report. Oftentimes that's at the provider's cost from the manufacturer for wholesale rate. The corresponding Medi-Cal provider manuals on hearing aid billing and reimbursement are going to detail additional information if you're not already familiar with billing hearing aids through Medi-Cal about what documentation needs to be included with the claim itself. For services that are rendered by audiologists, the Budget Act of 2022 restored full reimbursement rates following prior budget cuts from AB 97. So that implementation is also effective retroactively to July 1st, 2022. We're very excited about that. We do have a sample of a claim for HACCP. So the one thing that we kind of, I can't even call it a difference, but just kind of a clarification, is that where it says insured's ID number, you're going to use their HACCP ID number from their HACCP program ID card, where you would ordinarily put their BIC number or their SIN for Medi-Cal or their insurance number for a private plan. So that's just right in the upper right-hand corner. Everything else is going to be the same as what you're used to. If there was a corresponding TAR, you're going to make sure that you put that as the prior authorization number and that the dates of service line up with what your range was on the TAR, procedure code, number of units, all of that is going to have to be consistent within the scope of what your TAR was approved for. If you have any questions about that, we definitely encourage you to reach out before submitting the TAR so we can make sure you're not going to have any hiccups down the road, because we would like this to be a really smooth experience for you as well. We do provide similar guidance to families for documentation to bring to their child's first appointment, trying to make the TAR documentation more streamlined and just as easy as we can for providers as well. So we're asking them to bring their HACCP ID card because you're going to need that to check their enrollment on the date of service in AIFs, just like you would Medi-Cal or private insurance. If they have other health coverage, then you're going to bill that first, and HACCP is going to be the payer of last resort, just like in Medi-Cal. So if they have other health coverage, we tell them to bring you their health insurance card as well. Any documents they have from earlier appointments, like the hearing aid prescription from their otolaryngologist, the medical history and examination notes from the child's otolaryngologist, including medical clearance, which again can kind of combine into that hearing aid prescription piece. And then the hearing aid recommendation and audiologic report from your child's previous audiologist, any other documents that you might request. So, we recognize that you're going to be the expert and no two patients are the same. So there might be additional pieces required. But we also try to kind of provide the context for families so that it's not a surprise when you may ask for some of these documents at or after intake, make it easier for them, hopefully, to not need to try to track down some of these after you've already got the TAR started, if they can just gather and kind of keep things together as they go. Just kind of for that additional kind of context, we've been asked to include some of the FAQs that we get from families and patients. Some of those are for a child who qualifies for CCS, should they switch to HACCP? And our answer on that is always going to be no. If they have CCS coverage for hearing aid related benefits, that's going to be more robust than what HACCP can even provide. CCS does a great job at including wraparound services and other pieces that go beyond the scope of what HACCP has funding for. So if they're able to access that broader coverage for those expanded services, definitely take advantage of it. Additionally, for a child who's enrolled in CCS coverage for a hearing related condition, they're not going to qualify for HACCP because we don't duplicate that existing coverage. For a child who has partial insurance coverage for hearing aids, will they qualify for HACCP? So yes, effective at the beginning of last calendar year, families may now apply for supplemental hearing aid related coverage through HACCP if their existing health insurance limits hearing aid coverage to $1,500 or less, or again, excludes hearing aids from the coverage. When this is the case, they're going to need to, again, attach the explanation of coverage for their insurance, something that kind of articulates for us the scope of that hearing aid coverage limitation. So each family should be receiving an explanation of coverage document when they first enroll in the plan. But if they can't find it, they can also call the health plan's member services to request a copy, or they can reach out to HACCP's call center and we can help them see about locating a copy or at least a contact where they can request a replacement copy. Similarly, we have a lot of folks, families and providers, both asking about coverage for bone conduction hearing devices within HACCP and whether these are covered. The answer is yes, for some. Surface-worn bone conduction hearing aids, or BCHDs, are covered when they're medically necessary, but surgically implanted BCHDs are not covered by HACCP. So if it's surface-worn, so like worn with a soft band or like the adhesive attachments or similar external attachment only, then that is coverable by BCHD essentially as like an expanded definition of hearing aid. And you would use the same attachments in submitting your TAR that you would use for any other new hearing aid. BCHDs do require TAR approval. They also have some separate corresponding codes. These are all listed in the HACCP provider manual, but there is, for example, a distinct battery procedure code for the zinc air batteries that are associated with BCHDs as opposed to the regular or kind of default battery procedure code that applies to most hearing aids. So there are just some kind of caveats like that. This is one of the areas that we're working on, further expanding the resources that we have to kind of clarify, BCHD coverage and related information that you might need in supporting children who need BCHDs. If you do have additional questions, please reach out to us or recommendations on how we can make things clearer. We really want to make things as easy to use as possible. So always appreciate your insights there. Similarly, a lot of parents ask whether they need to pay out of pocket for HACCP covered services. And the answer is no. Providers are not allowed to balance bill HACCP members, just like they're not allowed to balance bill Medi-Cal members. They bill HACCP directly, just like for Medi-Cal and CCS. If you have partial insurance through a health insurance plan, your provider has to bill your insurance first. To the extent that this requires copay or co-insurance, the provider can actually include that part that's excluded from the private health plans coverage in their claim to HACCP or Medi-Cal as well. So just making sure that, families and members shouldn't be having to pay anything out of pocket if it's for a covered benefit. Similarly, we get asked, is there authorization needed to see an HACCP participating audiologist? So some audiology services And certainly many of the things that audiologists dispense, like hearing aids, would require a TAR, but the appointment itself doesn't necessarily. And again, a TAR can be submitted before or after a service. So for the most part, well, the answer is always going to be up to a particular provider. But understanding that we're in the context of providers here, for the most part, what we see is if it's an audiological service, most providers will just go ahead and provide the service, especially if it's for a test or something. Go ahead and provide it, and then to use tests as an example, they'll attach the test results as documentation that it was needed, which is not necessary, right? You can certainly submit the TAR beforehand and just explain why you believe it's medically necessary. But if it makes more sense for your billing processes and efficiency to just go ahead and, see the patient, conduct the testing, submit the TAR afterwards, but before you submit the claim, attaching the test results can be an efficiency, so that you don't have to do so much explaining about why it's medically necessary, because you can just show us, hey, look, it was clearly medically necessary. There's a difference here. So those are just kind of some convenience factors that we want to make sure are included. And yep, I see we've got a couple more questions. Yes, the slides and hyperlinks will be available. And yes, batteries are an included benefit. There are at least 2 different specific codes right now. And we are actually in the process of reviewing some additional ones for potential coverage as well. But all of the HACCP covered benefits procedure codes are listed in the HACCP provider manual. And yes, the slides with the links will all be available on the HACCP events archive page. Many of these links are actually also available on the HACCP web pages for providers. So we have a guidance for providers webpage, as well as a resources for providers webpage that will kind of bring you over to where you can sign up for provider updates. If there are resources that are new audiology and hearing aid resources that are published for Medi-Cal and HACCP, things like that, as well as where you can find the big collection of existing resources. What happens if my child's application for HACCP enrollment is denied? So if your child doesn't qualify for HACCP, the parent or the child, if they're old enough, like for young adults, will receive a letter explaining which eligibility criteria were not met and how to request reconsideration of the application if they feel there was a misunderstanding or the circumstances have changed so that, okay, maybe they weren't quite eligible then, but something has changed and now they would be, as well as other programs that might be able to help. So for the most part, if somebody applies for HACCP and doesn't qualify, it's because they already have better coverage through Medi-Cal or CCS and maybe didn't realize they still had it in some cases, or hadn't had it confirmed yet and applied for both programs at the same time. But kind of during the application process, the HACCP found out like, oh yeah, we're approved for Medi-Cal. Or if they didn't realize that they're income eligible for Medi-Cal. So if you're eligible for Medi-Cal, we refer the member over to the county for assistance enrolling. There's a warm handoff process where we connect them with the appropriate resources from the member or family side. And we also let the county know like, hey, DHCS received this application for HACCP, but we're referring them over to you for assistance with enrolling in Medi-Cal instead. So we want to make sure that those are getting caught and that folks are having access to the best set of benefits that they're eligible for, which for children in CHIP counties, for example, the family may not have known that there was a higher income threshold that made them eligible, things like that. Sometimes folks are surprised that they're eligible for Medi-Cal, or they just forgot and didn't get around to the appropriate paperwork. So that's kind of the main piece. Generally, if there's something if there's a situation where somebody truly is not eligible for HACCP or like more inclusive coverage, then that might just be because they, are over the income limit or similar. So we'll always let them know and then let them know what other resources might be available as well. We do have a number of additional resources as far as contact information goes and online web resources. So the HACCP Help Center is available during business hours, Monday through Friday and Saturday mornings as well, at 833-774-2227. We have translators for all Medi-Cal threshold languages and some additional ones. There's video relay and TTY/TTD available. You can also chat with us in English or Spanish online by visiting dhcs.ca.gov/HACCP. And the web chat there is secure and HIPAA compliant. Okay, so it will facilitate uploading documents if there was something missing, or say if you're referring somebody to apply for HACCP coverage and they submitted their application, but you were still working on the referral form or letter, they can give you their kind of reference number from the application so that you can include that and you'd actually be able to upload it directly. So some of those pieces are available. The secure upload is available 24/7. And then the chat part of it is available during the Help Center hours. You can also email haccp@maximus.com, but we request that if you do that, it be for general questions. And we try not to use like PHI in that format. The Telephone Service Center, or TSC, is also available for Medi-Cal providers who have any questions or follow-up needed related to TARs and claims. For example, if you want to check the status of something, you can go ahead and call the TSC and they'll be able to assist with that. We have HACCP online resources as well. So the same webpage that you would go to be able to access the web chat is the HACCP homepage, where you can learn more. We've got resources on there for families and members. We've got resources specific for providers. If you're a community partner, like maybe a teacher who wants to be able to provide information to students who might benefit from this, there's community partner set of resources that has all sorts of helpful tools, flyers. If you want to put something on your social media, we've got all the graphics and everything for that too. There's also a link here where you can refer any patients who are ready to apply online for coverage. That's going to be haccp.dhcs.ca.gov. So like the homepage, but reverse it. Do want to make sure that we've covered all of the questions. We really appreciate you joining. We do have some additional upcoming events as well we want to make sure folks are aware of. Our next webinar for families and community partners is in just about a month here on September 12th. So that's going to be at 11 a.m. Trying to make it convenient for parents whose children are maybe in school during the day. But then our next update for medical providers is going to be Tuesday, November 12th. And that'll be at noon again, so we can hopefully fit it into the lunch hour conveniently for folks. Just going to go through questions, make sure we've got things covered, and then we'll also, where we don't already have answers for these, work on incorporating these into additional resources for the program as well. Like I said, who do we submit the TAR to? So the TAR is going to be submitted to DHCS, just like for Medi-Cal. And we covered the web page, which is just the Medi-Cal provider portal, and the address if you prefer to mail that in. But I'll make sure to include the links as well. And then those again are in the slides as well, which will be published online. Batteries are a covered benefit, and there is a list of codes that requires a TAR. So if you look in the HACCP provider manual that was linked here, I stop sharing just a moment. I might actually be able to pull this up for you. We have, that's a really good question. We have a side-by-side table of which procedure codes are covered and which ones require a TAR. So some will say generally doesn't require a TAR. In those cases, there may be exceptions for certain provider types. In other situations, there might be a note that says requires a TAR if you are requesting more than this number per date of service or more than this number per year for the same member. So we want to make sure that that's definitely as accessible as possible. If you have questions on it, or if you want more information kind of in depth on a particular code, you can always reach out to us and let us know. So we definitely want to make that as easy as possible for you. So please let us know if you've got any additional follow-up questions. The process for providers not yet accepting Medi-Cal and HACCP. So if you're a CCS paneled audiologist and was a Medi-Cal provider in hospital settings, however, I have just opened a private practice and I'm curious about whether dispensing hearing aids for Medi-Cal, CCS, HACCP is feasible for me. Thank you. Awesome. Glad to have you with us. So CCS has its own paneling process that I'm not as much of an expert on. Medi-Cal is the only enrollment process you would need to go through for Medi-Cal and HACCP. The kind of addition for HACCP is that we really highly encourage, like I said, that you opt into the HACCP provider locator. So that it's easy for families to find you and know that you're accepting HACCP coverage. Because any Medi-Cal fee-for-service provider is eligible to provide HACCP services, but not all are as familiar with the program yet, since it's still a relatively new program, even at a couple years old. There is a big, it makes it much more accessible for families to find which Medi-Cal providers are taking HACCP coverage if the HACCP participating providers list themselves in the provider locator. That makes it a lot easier as well, because I'm sure you're familiar with the importance of early intervention with these types of services, for them to be able to find a provider more efficiently as well. So we really appreciate your help to be able to do that. To make sure that I've got this link here for you as well. So we've got, let's see, I think PAVE is the link that you would need for enrolling in Medi-Cal. I'm going to include that link here. Okay. And then we also have another one here in just a moment that will give you some additional information on opting into the HACCP provider locator. And these links are also available from the HACCP web pages, or just searching for the Medi-Cal provider resources or Medi-Cal provider enrollment on the DHCS website. Okay. So make sure you've got this link as well. And then Marcia, I see your question here as well. Thank you. Okay, so we've got where to find the billable codes. Yes, absolutely. So that is going to be in the HACCP provider manual, which I have a link for right here. Okay. So that does, like I said, have a column that has notes on the codes if there are specific TAR requirements. There are some notes throughout there that'll, help with clarification on whether, the appropriate quantity for a binaural set is going to be 1 because the code is already a set, or 2 because it's per unit, things like that. We try to make it as easy to find the information for each code as possible, but that is our go-to for all of the coverage details on the HACCP covered benefits. And again, if there's something that's not there as far as, what documentation do I need to attach, or what's the policy in this scenario? We try to point you towards the applicable Medi-Cal provider manual as well. So for the most part, those are going to be in the same, section 2 with the allied health and the audiology and hearing aids topics, where you're probably used to finding Medi-Cal information and CCS information on these topics already. So I want to make sure I've got this link here as well. Okay, and then let's see. There are some specific pieces in here too for the battery codes as well. I know a lot of you probably have 1 o'clock appointments, and I've seen some people kind of leave messages that they're dropping off. So I just really want to be respectful of your time, but thank you so much for joining us. We really appreciate having you here and partnering with you to help HACCP enrolled kids access the hearing aid benefits they need. We look forward to hopefully seeing you at some future webinars or chatting with you about how we can kind of team up even more effectively. Please do let us know, like I said, you've got the contact information now for the help center. Please let us know if you've got any other questions. And again, thank you very much. We will see you next time.